Hi, it's Natalie. I want to show you how to look up prescription drugs on Medicare.gov. You're going to go to the URL page. You're going to type in www.medicare.gov. If you have a user ID and password, or if you want to create one, you want to go to log in. If you don't have a username and password, it's easy enough to create an account. You will need your Medicare card nearby. I'm going to show you how to do it without a username, but I do encourage you to create a username. So you want to go into health and drug plans, then you want to find health and drug plans right there. You go in, you're going to put in your zip code, continue. I'm looking up a prescription drug, Part D plan, find plans. I'm not involved with any of these extra help, so I'm going to say I don't get help from any of these programs. If you do complete that, you do want to add in your prescription so that you can look at prescription plans. So I'm going to say that I take a torvastatin, which a lot of people take it. I get a 3-month supply at a time, and I take it once a day. So I'm going to put the milligrams, the quantity, and I fill it every 3 months. And I'm going to put in that I take an expensive prescription, like Eliquis. Put in Eliquis, the 5 milligram, I take it twice a day. So I do 180 every 3 months. I'm going to add it to my drug list, and let's go on from there. So I'm done adding my drugs. Now I want to select pharmacies. So I always want to look at what mail order is. You could pick up to 5 pharmacies. Then I'm going to say I want to go to CVS. I want to go to this little pharmacy called CX, and I want to go to Walgreens. And you can pick up to 5 pharmacies. Continue to view plans. So based on my prescription, so this is showing me now, because I'm doing this in August, this is just showing me September to the end of the year. So when you're enrolling, when you're doing this after October 1st during the annual enrollment period, this will look a little different. But if you can see here from September to the end of the year, they're recommending that I enroll in the AARP RX Preferred Plan. The monthly premium is $107.50. It's a high monthly premium, but if you look at the total cost of my drugs and my premium for those couple of months, it's $742. If I go further down, it's $871. So while you look at some smaller premiums, here you go, you're paying more in your out of pocket. So when you look at this, what you want to look at again is the first one is going to be your least expensive prescription plan. If you're already on a prescription plan, it'll show you what your current prescription plan is and then what a new one would cost. If you're currently on a prescription plan and it's close, you might want to just stay with that plan, especially if you already have prior authorization from that insurance company for one of your prescriptions. When I go into the plan details, you can see here it's telling me the premium, it's telling my estimated drug costs, and you can see pharmacy, mail order pharmacy is going to be a little less expensive. But if you go further down, it's going to do this for you. It's going to remind me of my drugs. It's going to tell me which pharmacies are preferred. And then it's going to tell me, okay, if I go to Walgreens, I'll pay $312 for my prescription. But if I go to this more local pharmacy, I'm going to pay a little bit more. It's up to me which one I want to use. This is just to give you an idea of the cost. And you can see mail order is the most cost-effective method. So they'll show you what that cost is, and then they'll show you what that cost is from now to the end of the year. Also, will tell you every 3 months what your copays will be based on these other pharmacies. So let's say I want to do Walgreens. If I want more detail, I'll open up the Walgreens screen here. I just click on Walgreens, and it'll tell me what's the retail price, what's the cost after the deductible. This plan happens to not have a deductible. And then if you ever hit for 2025, the $2,000 maximum out of pocket, and for 2026, the $2,100, this is what your cost will be after you hit that. So this plan looks good for me. If I'm ready to enroll, I go to the very top again, and I click the enroll button. When I click the enroll button, I want to do join plan. And on here, you want to confirm your enrollment period. So if you're brand new to Medicare, your Part B is recent, you're going to say, I'm new to Medicare. If I was working and I've lost my employer coverage, I would click here. I left coverage for my employer if I'm over age 65. So I am new to Medicare is that you're right within the 3 months of your 65th birthday. If you are more than that, you're going to say I left coverage, and you're going to say what was your last day of coverage. So mine happens to be 8/31/20 2025. So that gives me a special election period where I'm entitled to apply for this plan without any penalty. I'm going to continue through. You don't need to fill out any of these other ones. Go to next. Well, if you already logged in, it'll already put in your Medicare number, so that'll be pre-filled in for you. And you want to click that I've read, and you just want to continue. It won't let me continue without putting in that information, but it's pretty self-explanatory after that. I will share with you, many people think they want to do Social Security deductions for their premium. That is fine, as long as you understand if you receive a bill, you must pay that bill until they start deducting it from your Social Security. Also recognize, those of you who have been doing this for a few years, you know that your drug plan may change every year, that if you're changing your drug plan from 2025 to 2026, sometimes it takes a few months for Social Security and Medicare to talk to each other. So they might continue taking your deductions for your 2025 plan, and then a few months later, they'll start doing the deductions for the 2026 plans. So it does get a little complicated. So I do encourage you not to do that. This is it. If you have any questions, call our office. Thanks.